Good evening, everyone. Warm welcome to today's program.
Good evening, sir.
Good evening. And today's program basically is our students. Dr. Mini's idea was, sir, why not we add such type of activities like interventional sexual therapy? So I like to have some my presentation on the today's interventional sexual therapy. Before that, I will introduce for those who are new. I did my MBBS, DPM in psychiatry and DHPS and MD and PhD in sexology affiliated to ACS, American College of Sexology, US, California. I am an honorary consultant in sexual medicine OPD at Aditya Birla Memorial Hospital, Chinchwad in Pune, and honorary assistant professor at DY Patil Medical College, Pimpri, Pune. Director of WNHO Institute of Sexology affiliated to American College of Sexology, California as an institutional membership and course, and we are the course coordinator. I am president of WNHO organization and trust because we need the trust, educational trust, and which is under the proposed patronship from the Health Ministry of State and Central Ministry of Health. Director of WNHO Healthcare Private Limited, Pune is a government recognized startup working as a full-time sexologist at WNHO Clinic, Sadashivpet, Tilak Road, Pune. And I am a life member of CHEPI and life member of Indian Medical Association. Now I go ahead with my short introduction, and what we are now recently we presented 4 books we prepared and we uploaded at Amazon, Kindle, and paperback and other this hard copy book. This is internationally is circulation, and these books you can get the idea if you just write down go to the Amazon and Kindle, you write down Professor Dr. Ramesh Maheshwari's book. You get the list of the book you can buy, you can order. If you want, you can read on the Kindle, that is free for the reading. But if you buy, they have to pay minimum $10, $15. What is the cost of preparation of that books by the Amazon? Now my next slide, just because today what happened, my main Wi-Fi is not working, so that I'm using this just like a Geo's router. I think it will work. If not, will stay with me. I will try my best to present everything. The interventional sexual therapy. What is interventional sexual therapy? This is our Sexology Institute. We just registered 3.5 years, maybe 4 years over of this registration of Sexology Institute Pune under the government recognized startup WNHO, and this is our institute. I am working as a sexologist since last 25 years. In this we made the various group because we had the 2,000 patients on the shockwave therapy along with these various line of treatment. That's oral therapy, and that is oral phosphodiesterase like tadalafil, sometimes sildenafil. Most of the time patient says after a few months, after a few years, it's not oral therapy can't work them as what they want. Viagra is not working, tadalafil is not working. What to do, sir? At that time we decided to have the study with shockwave therapy. So we made the group first only on oral therapy, like a standard line of treatment, like very well, tadalafil, sildenafil, and vardenafil, and so on. That is oral phosphodiesterase. Second group is shockwave therapy, low intensity shockwave therapy, commonly known as SWT. Group C is about shockwave therapy, oral therapy along with this shockwave therapy. Group 4th, shockwave therapy with PRP, platelet rich plasma, is known as the P shots, that is injected in the penile software. We will go step by step in our further presentation. All this for A, B, C, D, E is a group, 5 groups. We made the out of 800 patients, and we keep here our whatever the results and patients these things. Now these are my Practo platform where we register each and every case so far in last 15 years. That is around 32,000 cases. So whenever you come to Pune, you can see all these patients and you can find out their treatment and other things if you want. Basically, we have the or patient comes to our OPD are mostly lack of desire, low libido, nowadays very common. Erectile dysfunction, it may be psychogenic or organic if it is associated with hypertension, diabetes and other cause, or it may be vascular if it is blood flow and everything is reduced toward the penile shaft. Such cases, vascular these things and other even common whatever patient comes to us is the primary line of treatment is a shockwave therapy. When I seen at US and Canada, I was there in lockdown time, and I observed that they each and everyone not advised give the medicinal line of treatment like Viagra, sildenafil is not given directly, is not easily available, is not easily prescribed by the physician. They give the shockwave physical therapy like shockwave therapy, even acupuncture, meridian stimulation therapy we included here in our treatment module. Now my dear friend, we go ahead, we take the consent letter of each and every patient is a must whenever comes to your OPD, because nowadays gender identification is very important things, and 80% are heterosexual and 20% are gay homosexuals. So that is a law map and other things you have to evaluate. That part we will take in a detail when our session goes ahead and our frequent Zoom meetings. Or it is a common platform. Every doctor attending this program is my colleagues are free to give their suggestions, their advice, their research activities, because this branch is lack of unknown factors, so that you can. Now worldwide erectile dysfunction is patients are more than 150 millions, and it may reach to almost double or 233 millions within 5 years, 2025. That is estimated by survey. ED is a frustrating condition that we can see in our OPD. Everyone knows erectile dysfunction patient comes, affect more than 50% of cases between the age group of 30 and 80 years men. Aim to provide non-invasive sex therapy. We need low intensity shockwave therapy unit at our clinic. Officially called low intensity extracorporeal shockwave therapy, the procedure is more commonly known as shockwave therapy. It is a misnomer. So there are no shocks, but it's the radial acoustic low intensity sound waves passes through the penile shaft, and that treatment consists of non-invasive. There is no any medicine, no any that things are injectable here. Low intensity sound waves that passes through the erectile tissue, restoring natural erectile function by clearing plaques out of blood vessels and increasing the growth of new blood vessels. Means that's in short is a revascularization therapy. You can say is a shockwave therapy is a. And this is unit. What is my clinic? I taken this my clinic unit. We selected 800 patients because out of more than 2,000, 3,000 patients registered so far in the shockwave therapy. We did because some are left the treatment, some are continuous. Those who are continuous and regularly having a treatment as more than 4 to 12 sessions is we consider here in our study record. How this observation you can say. What we Here we have found they are very good. Those are a severe curvature is also, and those having a pain in a penile shaft also reduced. And these are the mark in the at the end we are going to discuss in detail. Now, how it works? This is a interventional sexual therapy. We added this because this is a new recent in most of the corporate hospitals having this such type of therapy under. Some are under urologists, some are under even a physician or under psychiatrist. This therapy is very common here. 4 hertz frequency waves, sound waves, has passed through about 1000 to 1500 waves, and that is a energy kept as a 10 joule mg. That is this is a energy actual for during the treatment. This is a treatment we use. These are the norms what we use. This is automatically computerized. This is very easy. Just you have to do the work like what you call technician, or that's giving the treatment. Now, my dear friend, we go ahead. These are the things here. These waves are used on a penile shaft, all the ways, all the direction you can give all around shaft, directed V-shaped. V-shaped is the base we give like this to stimulate the muscles and rejuvenate it, and revascularization helps a lot because all calcium particles and whatnot attached to the blood vessels are what you say is micro, you can say break up and break down, and that then it pass and absorb through the blood, and the clearance of the volume of the blood vessels has improved. This is a story about the shock wave therapy, and it is a really very good. We are very frequently we are using, and patients are very happy after 4 to 8 sessions, and some patient may get the relief up to 1.5 year or 2 years, or some are even 6 months, like that, may need more. Now, these are the where shockwave probe, and here just penis. I have shown the model of the penile shaft, and this is a protector. What we use is a simple thermocol sheet I am using with the what you have perhaps with tissue paper, and for hygienic point of view, and we just have this replace this disposable cap over this, and sound waves started and sound waves pass through it, and this is a therapy purpose and how it works. Now, oral therapy, you know very well, we use sildenafil, tadalafil, vardenafil. Even most of the time people are giving a tadalafil 10 mg, and I think it is not necessary 10 or 20 mg. Give 2.5 mg, not daily, alternate day you can give the tadalafil. That gives the effect about 48 hours. 24 and more than 48 hours is more than sufficient. So the dose is reduced and patient side effect is less. So tadalafil is a very good drug. You can use each and every case. Not more than 2.5 mg what I am using. And sildenafil you can use even 25 mg or lesser than that, because there will be no headache and patient tolerance is better. What I found in my this 25 years practice, and administration, I told you because here in my clinic, even the patient are, even the doctors, few doctors are giving a daily or alternate day shockwave therapy. There is no harm, but we are using this shockwave therapy every weekly, so the patient is convenience, and for 4 sittings, then after forcing, if they improved 60 to 70% early morning erection is rigid and better, then we advise them once in the 15 days for 4 sittings and once in a month for 4 sittings, like a total 6-month therapy, so that the patient is a prolonged period with us and they have the improved well, and we know the patient's psychology and other things, their other factors. Suppose the patient is obese, then there is more estrogen secretes in such obesity cases. At that time we reduce their weight, and that is also mandatory in each and every case we advise here in my clinic. Weight should be under control so that more and more testosterone increase in the blood. Sometimes we use with the combination therapy with the P shots, that is called the PRP, platelet rich plasma. This is separated by the blood of the same patient himself, and it gives centrifuge at 1500 rotation for minimum 15 to 20 minutes. Then it is filtered and it is taken and is again centrifuged and used for more platelet, that is examined. Those are pathologists, they know very well, and this is used for the healing purpose. And we use here in the prick to the penile shaft in laterally 1 2 3 1 2 3 with 6 side. Even it is given on the glass. My dear friend, that is the best of the treatment. Here shown how the injection is, and just for your understanding I showed the site. It is used with the only insulin syringe, not like a 1 ml other syringe shown here, but only insulin syringe we prick it. Now my dear, this is another story that we have given oral therapy cases we kept in and there because they need the treatment again and again because it's a temporary one. Then we use shockwave therapy that give the prolonged effects, maybe depend upon 6 months to 1 year or 2 years. Then we added oral therapy with shockwave therapy together, because this lumen is increased, or all deposits will be is removed from the blood vessels, but blood flow should be there, so that we give the 2.5 mg tadalafil alternate day to increase. We found increased blood flow after the shockwave therapy. So it is advisable. It is our observations and you can say finding and research that is the combination therapy helps a lot with shockwave therapy with orally tadalafil group, because its effect is not for 1 or 2 hours, it's continuous 24 hours 48 hour blood flows toward the vessels and get the more and more dilatation and more and more feeling of erection and well-being. Patients are happy, he feel I am now totally cured, and psychologically also impact. Now my dear friend, along with this we said we develop one unit for that is based on TENS and EMS, based on old days acupuncture therapy, that is called TCM, traditional Chinese method, TCM, or medicine, traditional Chinese medicine system, and where we use various this lung meridian and kidney meridian. That is the kidney meridian you can find here. It starts from the just see feet to is the middle side, and it goes, this is the kidney meridian, and both the side you can stimulate it. In urinary bladder meridian from the head to down this much. These are the all lines. You can get everything on the Google, or you can read only kidney meridian and urinary bladder meridian for the treatment point of view, and better results and prolonged results to your patient. This unit is available and we made it for our patient purpose to pain relief, along with this acupuncture TCM treatment or this meridian stimulation treatment. This gadget is handy, and this is prepared. It is manufactured by our Indian company, that is Jodhpur, and he's export this to the US market as well, and they export the US market shockwave therapy unit as well. And our doctors can get it at concession rate around 20% or 25% or more than that. They are given up to 30%. They have given concession in this unit as well. You can details, you can get it. These are all gadgets available. You can get it, and we feel that sexology is very closely related to cosmetology. If your look is not what you say, it's not inspiring or not look is not proper, then they will can't enjoy this, because desire is very important factor. If there is no desire, then in a male no erection. If no erection, then sometimes they get ejaculated fast and they no orgasm and other things. In female, instead of erection, there is more secretions. That is the only basic difference that we will teach in our detailed program of psychosexology or psychosexual or cycle of sex cycle, you can say. Erotic zone stimulations, what I told you, what is Chinese method we use, kidney meridian, urinary bladder meridian, or anything body, anywhere you can touch have the erotic zones, but mostly this, and ear is called as a acupuncture point of view, is the most stimulating part in the orgasm, to reach the orgasm level faster. Procedure of papaverine injection, sometimes we use intravenous injection, is very low, one insulin syringe, one ampoule is around 80 mg, can be divided in 25 syringes. You can prepare and can advise, because we don't need more. Papaverine have a long duration, may causing what? Fibrosis, so we avoid frequent injection. Procedure is same. Sex exercises, yogic exercises, we advise them have you can say Surya Namaskar in short, or pelvic floor exercises and all. You can add on these all exercises along with this. Sometimes patient comes, everything is normal, but the fertility issue. At that time, we advise the sonography of uterus or sonography of pelvis of the female, and we find out whether the position of uterus. If it is retroverted, then we advise them have the sexual intercourse in the doggy pose, and most of the patient gets results and they conceive. If suppose they having one position, introverted position, at that time we advise pillow below the back and have the intercourse for the better penetration and reaching the sperms towards site. Posture therapy. Now you can understand so far shockwave therapy, medicinal line of treatment, then PRP, platelet-rich plasma therapy, meridian stimulation therapy, and posture therapy. Now next is the most important is psychoneurobics. What is psychoneurobics, my dear? You know the 7 centers is called chakras, mantras. That is the Bij mantras is a psychic flexus that is in the body at the back, you can say in the spinal cord, and that you can stimulate with the Bij mantra. It's simple, Om Hum Yam Ram Vam Lam. You can stimulate the Lam and Vam, and Lam is a Bij mantra for stimulating your lower spinal cord by vibration, and that will help those who are practicing yoga, meditation with Kundalini meditation and so on, or chakra meditation. They can realize the importance of these things. We teach you one time. We take the demo also, and hands-on training. We have the session of every session for 10 to 15 minutes and like that. My dear friend, I'm not taking your much time. Still, I like to present something. Is a BMI and BMR is very important. Suppose you are overweight, then there will be less testosterone and more estrogen secretes in the male as well. And that should be, if you normal testosterone, then your body is like this. Bodybuilder, like this strong erection, high sex drive, healthy heart, confidence, elevated mood, mental focus, increase muscles mass, decrease body fat. That is very, very important. Whatever age is the secondary. You may be 60, you may be 40, you may be 30, but your weight should be normal. If you are overweight and obese in the 30 also, then it is useless. They can't perform well. My dear friends, that's why weight management is every case is very important, and obesity is the main cause of low libido and erectile dysfunction as well. My dear friend, so we advise, because not only exercise but along with the diet also is a very important role. And most of the time patients don't know how to go for foreplay, and they never stimulate their clitoral stimulation. They think vagina is a sex organ, but it's the wrong concept. Vagina is not the sex organ in the female. Main sex organ of the female is clitoris. I told, if you go to the anatomy of embryonic development of a baby, up to 2.5 months, sex is not determined because sex organ is not developed. After that, ectoderm, phallus of ectoderms in embryonic stage of baby is converted in a male in penis like shaft, in female clitoris, not the vagina. So clitoris is the female sex organ, orgasmic organ. And if clitoris is stimulated, if this basic is clear, then you can have the all myth and misconception you can remove from your patient, that size never matter. How long you remain in the performance mood is very important. If size may be whatever, but he ejaculated and he can't perform, that is useless. So my dear friend, you need performance, you need all the training and all this knowledge. So myth and misconception you can remove from the patient mind. Don't worry about the size. Go on stimulating. Even 2.5-inch penile shaft is sufficient to provide satisfaction to your partner. Now along with this, we need the personality. It's a very important factor. So far, my dear friend, there are 4 types of personality. And simply I will explain you extroverted and introverted personality. Extroverted is very powerful and popular personality. Introverted is peaceful and perfect personality. They want every work in perfect methods. And if not happened, then there is an interpersonal relationship disturbed. In such a way, such type, we need to, during counseling, we need to evaluate their personality and treat them and advise them accordingly, so that the patient relationship become better. Now my dear friend, if you have any doubt, you may have a number of doubts, you can ask after my session. You are free to ask me, because I am not taking your much time, because I know everyone's time is money and time is very important. Results indicate revascularization and angiogenesis lead to more increase in rigidity score before and after shockwave therapy. The erection hardness score questions based on, suppose score is 0 means penis does not enlarge, and score 5 is normal. Between these, penis score 1 is a penis is large but not hard, score 2 penis is hard but not hard enough for penetration, and so on. So you need the score of penile shaft should be 5 in erect. How to know? Patient improvement and self-assessment is also important. We ask the patient before shockwave therapy, you take the peak of your penile shaft in the erection mode, even flaccid mode, both. Keep it in your mobile, and always every weekly after the shockwave therapy, see the improvement, the change in your shaft and rigid. Most of the patients get more and more what you call diameter increase in the penile shaft, and they have more and more rigid or more and more hard, you can say. I have the one patient, he came from Canada, and he said Sir, I have the Peyronie's disease. That is a Peyronie is a curved penis, very curved penis because of fibrotic lesions and all, legs and all, and that it can't perform. In such condition, sometimes collagens are deposited there. Most of the time, patient taking collagen at their what you call health gym. People advise them collagen protein and shake with collagen and all, and they deposit and they have made the problematic sex life of my patient. This is very rare condition. 1 in 1 lakhs or 1 crore you can say, because I only few cases, 3-5 cases so far. And my dear friend, where keloid, during keloid, most of the those are dermatologists here, they know keloid, they give the injectable verapamil cocktail injection. Same use in Canada for the Peyronie's disease on a penile shaft, but they are no useless. After the 12 injection, they have improved with the low intensity shockwave therapy. Helped them lot. He has taken 30 sessions with me, and he is very happy and he can perform because 80, 60, 70% relief. And erectile functions index, erectile, you can use mild, moderate, severe, ED. You can have the various questionnaires you can ask. You can get such type of presentation, evaluation sheets on Google. Conclusion: significant improvement in rigidity score from 0 rigidity score to 4 and 5 normal rigidity after combining with low intensity shockwave therapy with the PI and PRP shots as an interventional sexual therapy. Second most important observation is that minimum 4-5 sittings is very important. If patient is taking single sitting, then it is useless of the therapy, of effect of the shockwave therapy for, during the evaluation point of view. Okay, my dear friend, our institute is WNHO Institute of Sexology is having a register under institutional membership of ACS, American College of Sexologists, our institute, and they have provided us this certificate. It is a continuously, you have to continue it every third year. You have to these things, because whatever we are teaching program, we send them, we are going to teach in all aspects, not only medicine line of treatment, but we also teach them. We also added shockwave therapy, P shots, and TCM, that is the meridian stimulation therapy and all, posture therapy with chakra healing and all. Our institute is a certificate recognition from the Startup India, and our Central Vigilance Commission certificate of commitment to us. These are the various work done by the others. Few, there are a number of lists, but few articles I mentioned here. My dear friend, our method, our mission is healthy India and preventive healthcare. Road for Rog Mukt Bharat is our latest view. 1 minute. We go ahead. We completed here. Our Startup India is ACS course coordinator and all things we added. Thank you very much. Here we will end our today's. We will discuss now. Today's my presentation is over. So I think everyone should present every time so that we can, or he can, or everyone will add on something here. And now floor, I will open this floor for everyone to, I advise everyone to allow the participant to unmute themselves so that you can talk one by one, and just start from those who are willing. You can raise hand or you can start, you can unmute yourself and start. Ashok Kumar, you can start. Damodar, you can start. And she is a doctor. Who is there? Doctor. Okay, go ahead. One by one. Now Zoom meeting is open for everyone. Present yourself, your opinion and all. Now I will ask one by one, so that is the better. Here is Yogantra. Who is the Yogantra guest?
Rajesh.
Yeah, go
Dr.
ahead.
Rajesh.
Raju, go ahead.
Yeah.
Yeah, just start your question
Uh,
answer. Yeah.
what I observed in today's session, it was very interesting for me because the first time I joined and the lecture was so important. So apart from the holistic development, apart from what I understood about the health, weight, and the mind, mood, everything is related to the entire in the broad horizon to treat the patient. So including you discussed about the sex exercise, and being as a yoga therapist, I know the importance of the chakra you talked. That's my dimension for teaching also. Yeah, how the chakra has the more important, especially for the lower first chakra, Muladhara and the Swadhisthana and Manipur. This whole entire practice is to let the higher level of prana, which influence not only the body level, not only on the hormone level, it's in whole entire body, mind, emotions, and as well as the soul. So that's why it's a very good to understand all the Chinese meridian. So energy, because the Chinese meridian is to stimulate the energy level, also that energy level needs for the cure of this problem, solve the problem. So these all are what I understood at a basic level.
Okay, thank you, Raj. And now, other doctor one by one, please share their opinion and their. So that is becoming very good, interesting.
Yes.
Yeah, you presented very well. I like it. You can be a best. I think you are practicing this thing, counselor.
Yeah, yes, sir. I am a tantra teacher also, sir.
That's why. Yes, good.
And I did my higher degree in Bihar School of Yoga, Bihar Yoga Bharati.
Okay, Munger.
Yes, sir.
Yes,
sir.
I have taken the Diksha from the Swami Satyanand. He is not more. Yeah.
Oh, great, sir. We are the same institution, sir.
Swami.
So I was set up there in university.
And he is from there, Bihar School of Yoga. Where I went near Raipur, and Raipur also, and at there also.
Oh, great, sir. Great, sir. I passed there 98, 2000.
Okay, good. It's good.
So my teaching, yes, sir.
Yes, we are just like a brotherhood
Yes.
of same
sir.
guru.
We are, sir. So that's why it make me more interested and inspiring for the subject.
Okay, nice. Anyone want to share their opinion? Please. I will ask then Damodar, Dr. Prabhu. Please, Damodar, doctor. Is not there. Dr. Sureka written here. Then I think Dr. Mini was there. She is no more here now. Anyway, second. Anyone want to discuss? They can. The forum is open for everyone. Please.
Sir, you have told about PRP.
Your name,
Let
please.
me know,
First,
sir.
introduce yourself so that we know you. Who are you?
Sir, myself, Dr. Ashok Kumar.
Dr. Ashok
From
Kumar.
Kanpur,
Yes.
Uttar Pradesh.
Yes. Go ahead, Dr. Ashok Kumar.
Just, sir, I want to know if there is any specific place for PRP. If we extract PRP, then where we inject and how much we inject.
That way generally we are giving 2 ml, around 1 ml to 1.5 ml every side of 6 sites laterally. I will teach you when you are on hands-on training program. They can see how we are doing here. That time we try to keep the patient for the PRP session, and it is very simple. And once you do it with local anesthesia, under local anesthesia, you can apply the lidocaine and prilocaine together. That cream is available nowadays. Very good. Numbex and other names. Just apply and keep for 35 to 45 minutes. So, and then keep the cold packs, keep the in ice packs cold from your fridge. You just keep it so that the pain reduces during a prick, and no need of nerve block and anything. You can do on your own table with pleasant mood. Patient happy and you are also do the procedure very well, and patient get the results. Mostly patient are happy after second session and third session, and patient improved 20 to 30%. They said, sir, we are feeling, and people are charging too lot for that P shots. Some are 25. I have one patient 30,000, 50,000 they paid. We are charging mostly 5,000 to 10,000 in between this mostly, and along with the shockwave therapy we can add little bit more.
So how PRP helps in them?
PRP,
What it does in that
PRP, how it helps? It there is a PRP nowadays used for the various treatment purpose. Even stem cell therapy people are using it for the hair growth. They are using for even various, even orthopedics are using lot of things. So we just trial basis this is going on. This is so far not not as such FDA approved, but shockwave therapy is FDA approved. Those patients are willing. So the consent letter is the most important things. You tell them these are the things. If you want, you can do it, and you can see that we don't give any false promises to your patient. But most of the time, patients are happy. Sometimes patient may not even 20-30% they had the results. Some are good, but it needs the frequent treatment. Not in one session it's over. And you can read more, because you may be doing, you are practicing as a cosmetologist also. So you are doing sometimes facial PRP is very good. Yeah, increase the glow immediately, you can see. And you can even, people are claiming of the hair growth, but we are not trying, because we in our practice is we use sometimes PRP for the face also, facial rejuvenation, and PRP for erectile dysfunction, for the growth of the penile shaft and so on. Anything more you want to add? You can add your own experience, no problem, doctor. Dr. Ashok Kumar, you can add your own experience. If you had done the PRP, had no results, whatever. And
no, sir, I am. It is my first lecture regarding sexology, and just I have joined recently.
Yeah. No problem. Everyone is like that. There are 25 students are registered. How many are here? 8 to 10 years. Now 11. Now 9. Like that, that is okay. It's a self learning process. I am here, you are here, you will share, we are sharing our experiences for better to our patient, for the point of view. The patient should get the more and more results. Because if the patient is not having a result with the oral therapy, what to do then? If the patient is low libido, then what to do in such cases? There is no specific treatment. You have to find out their antioxidants. We are giving zinc and selenium and other things together. Anyway, you can read our various. You get the doctor. You get all the PDF soon, one by one, all the PDF and notes, and you can buy all the books even on the Amazon. It is now there are 4 books. I uploaded clinical sexology, and this is available. All the books you should keep on your table, so that hard copy, that will help lot. That is a therapy, even most of the therapy, what to do for premature ejaculation, what to do for erectile dysfunction, what to do for infertility, everything is normal. And this is the way, what the oligospermia and azoospermia, we can't do anything in azoospermia, because we can help the patient for only oligospermia cases. Fertile tablet clomiphene citrate 25 mg is given for continuously for 3 months. You can have the 5 days in a month as a free from the fertile tablet and so on. You can prescribe. Every prescription is there, no problem. pharmacotherapy is there in details. Anything more now? Hello? Okay, now we